Thank you everyone for joining us today. Um, yeah, really no need. I guess I'll just say, yeah, this is a version of the presentation that was given there. So Stephanie, Mark, go through it at your pace. I think with just Nate and John and Amadou, obviously feel free to raise hand, ask questions whenever you want. We had decided just moments before to record this, so that if there was feedback specifically that was useful for the design of the inline evaluation, that we'd capture it. So I guess no harm there. We can continue to record that, but let's just capture notes. And I'm speaking to you, Karina, also Stephanie, Mark, wherever we can, anything that has implications for the design of the inline or the RMS2 report. But with that, yeah, just turn it over to you, Mark and Stephanie, and you can lead us through.
All right. Yeah. Thanks, Tom. Yeah. So, yeah. Next slide, Stephanie. So, yeah. Basically, the reason that we decided to set up this conference was a couple of things. One is, for various reasons, we wanted to present the findings from the various PREG impact studies that we conducted since the time of the PREG 2 baseline in 2018, and then to particularly for the RMS. So we've just completed, the fourth round of the RMS 2. So one of the things that was we particularly wanted to do with these presentations was to really sort of get validation from all of the PREG members about the findings, about what we're finding, sort of all of the extreme problems that are going on in northern Kenya that we're picking up in the we've been picking up in the RMS, and making sure that we're really capturing in our data collection process, what's actually going on in terms of PREG activities, humanitarian assistance activities, and so on. And then so that was sort of the first main objective. The other thing was to speak with all of the PREG partners, and get more information from them about sort of what their experiences are, particularly in the current drought and current things that are going on in northern Kenya, and to get information about the geographic variations. One of the things that as a bit of context and background, since we started in 2018, PREG has sort of changed their strategy quite substantially, and moved much more towards engaging directly with the county governments. So it's sort of an ongoing part of the devolution process in Kenya. But when we set up the baseline, in 2018, it was being discussed, but the implementing partners were, sort of not as engaged with the county governments as they are now. So that was another thing that we really wanted to get information from all the implementing partners, or the PREG partners, in this conference. Next slide. We had we really had like 3 days of meetings, but sort of formally there were 2 days. And one of the things that we wanted to discuss with the partners was to get a better understanding of how the PREG investments, the resilience investments, and the humanitarian assistance evolved over the time. And as I mentioned, the changing and increasing role of the county governments, and how that process influenced the way that PREG interventions were planned and coordinated in the county, and to get better information about the variations across the counties. As part of our reason for our interest was of this understanding of these changes was that we want to be able to understand these changes in the context of our sample. So we have, in our baseline sample. Again, this is a panel design. So the intention is that we will be going back to the same households for the end line as for the baseline. So we wanted to understand what was happening in terms of resilience investments and humanitarian assistance interventions within the clusters of our sample, both for the end line, but then also more specifically for the RMS too, which we're in the process of finalizing the analysis. So I guess that's the second point here, is that we are in the process. We've completed the 4 rounds of the RMS2, and but we are in the midst of the final analysis of those 4 rounds. And maybe just to step back a minute here, one of the reasons why we decided that we wanted to have this conference before we had sort of done the final analysis of the RMS2 data was specifically because we wanted to have this opportunity to get a better understanding from the implementing partners about what they've been doing since 2018 in the sample areas, how that's changed, and get a better sense of both the kinds of direct interventions that PREG partners have engaged in, but then also get a better understanding of these the systems level interventions, which we know are quite important and that are increasingly important in the PREG sort of mix of activities. So so that's really why we did organize this conference before we had the final analysis of the RMS2. We really wanted to be able to use this to inform our analysis, to be able to really more clearly associate, the outcome and impact variables with the kinds of interventions that were being undertaken within our sampling period. Next slide, please. This is just, sort of I pulled out some of the key research questions that from the original protocol. They're the usual broad questions that we look at about the impacts of interventions on, particularly, on the outcome variables, the food security, nutrition outcomes, and particularly to what extent do the interventions enhance the recovery of those food security outcomes. And then, what are the causal pathways? That is, how do the resilience interventions lead to improvements in different resilient components of the household resilience capacities? And then, these other questions that, again, I've sort of alluded to. We wanted to get this information about changes in the collaboration among implementing partners, and how that's been affected by the increased participation of the county governments in the in the coordination and planning of the activities of PREG investments. Next slide. So, just very quickly, so there was a baseline done in 2018. We're planning for the end line, which will be, later this year, is the intention. We ended up conducting 2 rounds of recurrent monitoring surveys, and both, all of the surveys or studied components include both quantitative and qualitative components. Next slide. And so, yeah, the 2018 survey was, 2,800 households in over 100 communities. And then the RMS, the 2 RMSs were sold, from a smaller subsample designed to have the similar representativeness as the baseline. I won't go into the details on how the sampling of the baseline was done. We can discuss that more if you want, but we had set up where we had sort of high and low impact initially at county level, but we've moved away from that. Now we're looking at impact in terms of actual reported participation or beneficiary within our sampling areas. So anyway, so we had the 2 RMSs in the years that are shown there. We're planning to, the end line will be done later this year with the same sample as the baseline. And there will be a qualitative component again, with key informant interviews and focus group discussions with community members. So that's sort of an overview of what we've done so far and our plans, our upcoming plans. All right, I think now at this point I'll turn it over to Stephanie to go through the presentation of the findings that we made at the conference. Well, actually, maybe I'll just stop and see if there's any questions or sort of about the purpose of this conference.
Yeah, I mean, I have a lot of questions because I do think I'm really interested in I think the purpose of your trip actually sounds really important. Like, how do you make sure that your expectations are aligned in terms of the way that the treatment is going? Like, what opportunities do you have now that you're at the end of the implementation to understand how, those certain modalities of collaboration you might kind of compare and understand. Mm-hmm. So I guess I'm curious on, and maybe you'll get into this, what form is the data that you took in about their programming, and how are you, as I assume you're trying to get an objective measure of treatment, as opposed to some participant reported treatment, which, can be really difficult to get them to understand whether this is even a PREG or some other effort. Can you talk a little bit about that data?
We will be getting into it a bit, but let me just sort of cut to the chase. Our strategy is that we want to triangulate the information that we'll be collecting from the household questionnaires about households direct participation in different activities. What we did in the conference was we split into groups by counties, and one of the activities was that so this was groups that included county representatives, county government representatives, and implementing partners that worked in those counties. And we had maps where we showed on the map the location of our clusters, the sublocation. And we basically asked those groups to identify in each one of those clusters what activities have been going on, and we asked, what was happening there in 2018, what's changed since 2018. So we asked about, it was to try and capture both activities that are where there's sort of direct contact with individual households, things like trainings and creating, farmer groups or VSLA groups, things like that. But also more of the systems level things like, what was there some kind of like, was there an implementing partner that was engaged in some sort of value chain supporting activity that would cover that area. So we're still in the process of finalizing it, and there was a bit of variation about the level of detail of information that we got from the different counties. So we're having to follow up with some of them, but that was the intention. So it was to get from the implementing partners information about implementing partners and the counties about resilience investments. We focused on identifying what PREG investments were going on there, or PREG activities were going on there, but also if there were any other investments going on in those areas that were not, from other donors, that we would want to know about as well. So that was the that's sort of the intention, I guess.
Yeah, I'd be interested to see how that data shakes out.
Yeah, well, we
Having
are,
done that.
as I say, we're in the process of finalizing that, and as soon as we have, they're on maps, right? So we created Google Maps that show, the locations, and then the participants have, they sort of wrote down what are the activities that were going on there, sort of starting from 2018 and the changes. We have photographs of those maps that they worked on, and we're in the process of organizing that. And as I say, we have some follow-up questions that we're going to have to send back. But we'll definitely share that with you as we get it organized.
Sure. Yeah, I'm really interested in it. And I'm curious around things like, for example, targeting, like, how did they select specific areas? Like, I'm sure.
So one of the things we spent a long time actually talking about the whole coordination process, particularly, again, as this has moved more to the PREG now works more collaboratively with the county government. So we spent a long time sort of having the counties basically explain their whole planning process for these activities, and how PREG PREG sort of fits into that process. So PREG as a program, they have they do sort of planning, collaborative planning with the county governments, but it's it's part of the larger planning activities of the counties themselves. So we got a lot of information about how, well, at least officially, how this whole planning process works, and how the county governments work to try to make sure that individual projects or individual investments are coordinated and targeted, so that they, at least at the level of in geographic areas, they're not overlapping.
Yeah.
So targeting at that level, we talked a lot about, and we have a sort of a better understanding in terms of the targeting of individual projects, of how they target who they work with. That is, I mean, we have information about that from at least the larger projects, but in terms of the targeting at the level of coordinating activities geographically, we got a lot of good information about that. Well, as I say, the official, and I imagine that the actual planning probably doesn't exactly follow what they presented to us. But.
And hopefully all of that can lead into your research question 3.
Yes,
Um,
exactly.
And I will be, yeah, I guess, given you're still shaking it out, I don't want to I know that this is probably still up in the air, but I'm really curious around how this is shaping up in terms of your treatment, your sample, and like how many folks you got in terms of treatment, and whether you're worried about some of the, issues that around how these were distributed and whether that's they're like, it makes me think about Prime, where you found some of the like reverse of what you might have expected at the beginning in terms of how the treatments actually were implemented.
Oh yeah. Well, we know that the treatments, within our initial sampling design, which was geographically, well, initially county based, right? Yeah. And we tried to refine that, in the first phase, in the design of the phase, the PREG 2 baseline. We realized we had, county was just way too big of a geographic unit for identifying or separating between treatment and control. So that was when we kind of moved to the identifying sublocations as being high or low intensity. But yeah, we also now know that that's not really a real accurate definition of the actual treatments. So yeah, we're basically following the same strategy that we have in all of these others, where we're at the end of the day, we're going to use the reported participation from the respondents, but then also this information that we now have about from the projects and the counties about what they were doing in those more of these systems level activities. So we'll be incorporating that in, and then obviously, so now we are going to have the usual sort of balancing issues, where we have where we ex post define the treatment areas, treatment sample, and so we'll have all of the issues about how to balance the analysis of the treatment and control groups.
I'm sure all this data will be really useful when you just gathered from the conference. So
no, it was I mean, we'll get into this more, but it was a extremely helpful process.
Well, I'll hold my questions. I know we're still stuck on the title slide, so
okay.
Sorry.
So this piece of the presentation, the first part talks about, uses the data from the baseline, from RMS1 and from RMS2 to do descriptive statistics and sort of give a big picture of what's going on in the PREG region since 2018. The second part is present analysis. The analysis only uses the RMS2 data because we had better measures of project participation in that survey, and we don't have the comparable information in the baseline or RMS1. And it's important to keep in mind that the two RMSs are separate draws on the baseline sample, so it's not the same panel going across all the rounds.
Yeah, and maybe just as a bit background, so we, one of our purposes for presenting this was to this larger group was for really to give a context for all of the participants about our findings, to help sort of create a context for where we can discuss their activities.
Okay, so as we talked about, this is pretty much the presentation we gave in Nairobi. We're annotating it with what we learned and hoping to have a discussion, which we're having, about what to do with this information and how to move forward, and hopefully how to incorporate something like that into other projects. What we found are that within the PREG region, the county level is what matters to the IPs, to everyone. We unfortunately don't have and never had county level sample size to be able to provide those to people. So that was a disconnect. We knew that it started to be an issue in 2012 when we did the initial Regal baseline was all about funding. None of these rounds could have been funded at a level to have an adequate county level sample size. When we started, it was the 952, where there were 9 counties within the PREG region. Since then, PREG has shifted and moved. At this point, PREG is focused on 6 of those 9 counties. So we presented in the aggregate, we presented what we had at county level, but we did get a lot of feedback about the county level sample.
Yeah, sorry, just to back up. So yeah, the initial design of the PREG 2 baseline, it was powered not by county, but by these intervention categories that we had. So as a result of that, we had a very sort of in terms of sort of different unbalanced samples from across the counties in our baseline.
We wanted to see too, with what we saw in our data, we wanted to verify what we saw in the data, and what we saw in the data is what we've been presenting, is that there's the horrible drought, and that there is pretty much no households were reporting either cash or food assistance. It was only the households that were part of the existing safety net program. We learned in our talks with USAID that there had not, in fact, been any funding for this drought until September of 2022. All of the funding, I think it's true today, has come from the US. US has been asking other countries to also contribute. There's been almost no outside humanitarian assistance around this drought. For counties and IPs, beyond PREG, there's the other world of other donors and coordinating all those funding cycles. So even though within PREG, it seems to be organization is okay and improving, there's all these other moving pieces for the IP or for the counties as well. One of the limitations which we're going to try to mitigate in the inline survey is that we have a comparison group sample. Because the baseline was population-based survey, our comparison group is in Mandera, which was the biggest population and has the biggest proportion of the sample. That is not a county that's currently in the PREG focus area. So this section talks about the trends and shocks from 2018 to 2022. The second section, we analyzed hunger as the variable, knowing that it's one of several that we can look at, and resilience capacities and programming affect different outcomes in different ways. There's not a one size fits all. This program will solve all these kinds of problems. So this is a picture of our sampled clusters. We took these maps, we took each county and printed it out on a big, Karina did this hard work and RLA on big vinyl maps, which people wrote all over the maps, and they told us what we knew. But you can see from here that these are fairly big counties and few clusters within the counties. So we had a limitation. What we can do is look at the PREG overall portfolio of investments and say something about that. The shocks data that we have, the data set that we have is remarkable because it covers such a long period of time, and it covers COVID, it covers this drought, it's pre-drought. It gives a really amazing picture of northern Kenya going through the last 5 years. This is the fieldwork schedule is superimposed on the FuseNet seasonal calendar, and we can see that this is from RMS 1, which was triggered by a drought followed immediately by floods in 2019. And then shocks had pretty much abated, and then came COVID. As it turns out, and as we see in our RMS1 qualitative data, households going into the drought seemed to be very handicapped because of the COVID restrictions. COVID came in planting season. COVID happened when livestock, it was the time to sell livestock. Even though livestock markets were open in some areas, people couldn't get to the market, and borders were closed, and there were transportation restrictions. So not a lot of livestock was moving. Small traders that would normally go to cities and towns to sell couldn't get there, and even if they could get there were no buyers because everyone had to stay home. The PREG programming was suspended during COVID. And then in October, the drought started and households were already at a deficit. RMS2 is all shocks all the time. The drought, it started, the drought had already been in place for more than a year. Then shortly after the RMS round started, we had the Ukraine crisis, and the failed rains continued. When we were there, rains started in northern Kenya and immediately went to flooding. These are the global shocks, not the sort of Kenya idiosyncratic subsequent shocks. They're important because PREG was never designed to address these. You can see on the far left in the September 2019, we had drought, which is up at 75%, was high. Prices were also high. And then the flooding, the blue line, starts in 2019. After that, in March, April 2020, shocks were fairly low, but and then COVID came and prices shot up. So this chart indicates that, you know, the price shocks in COVID were independent of any local shocks, and price and drought added to it. So in the second picture, they just overwhelm anything. There's not there, I don't think, and unless something amazing happens, there's no mechanisms in PREG to address these shocks. We have more idiosyncratic shocks. Both the qualitative and the quantitative show, you know, livestock disease, livestock deaths, crop pests and locusts, job loss, human diseases. We measured 23 shocks in our survey. We saw something really interesting in our sort of research methods, is that the qualitative data were able to pick up shock information that didn't show up in the household data. The main shock that showed up in the qualitative data is conflict shock. And it may be because either people are used to it or their household is not directly experiencing it, but it showed up in the qualitative data, and it showed up with the IPs talking about how that restricted their ability to operate. One of the things they said is, within these counties, most of the PREG programming is happening on the road system or in some sort of accessible area, that it's not out with the poorest of the poor in the pastoral areas. A lot of the reason for that is because of conflict, and that USAID in particular is restricted from going into some areas, and those areas continue to be the hardest hit. And the conflict problems are intensified by drought and seem to just be getting worse. Livestock loss, as everyone knows, it's unbelievable. It is not only asset loss, but it's a cultural big deal. People are coming home with no herds, and there are reports in the qualitative data of herders committed suicide, which were only 1 or 2, but it's going to be hard we also talked about livelihood diversification, people moving out of livestock, which on paper looks like it's happening, but the data missed this piece of, you know, somebody suffering. Women seem to be moving into more diversified livelihood. The men are devastated, and that's going to have repercussions along down the road. We looked at household responses to livestock loss. There's a lot of reports of households migrating to bigger areas. Women have been left alone for a long time, because pastoralists have been gone since the start of the drought with their animals, and women are starting small businesses, going into crop production. The qualitative data show that the strength of the livestock culture and low literacy are barriers to diversification. We would like to look in our analysis more closely at livelihood diversification and look at the role of PREG programming in this. It's an interesting trend, and I think it's an important trend. So the conflicts are exacerbated and growing. There's all groups seem to be fighting and arguing with each other. One of the underlying issues we learned is land tenure in Kenya, is that it's not clear who owns what land for most of the land. So for instance, a person can plant crops, and then in the nighttime, the livestock will come and eat all the crops, and the only recourse is to fight because there's no existing land tenure. When I talked before about conflict prevents PREG from operating in dangerous areas, and conflict also appears to be discouraging investors from coming in from Nairobi, from cities, and investing in this area. There was conflict around the elections. There's blocked access along the roads. It's an underlying issue that we need to pay attention to in programming. We saw some small scale, not really programs, but ways that people were working together to address this. One of the things that people were reporting is when livestock would come up to crops, the herders would go in advance and harvest whatever they were allowed to harvest and take that to the livestock. It did not appear to be widespread, but there are sort of ad hoc cooperative things happening. The qualitative data also show that theft is on the rise. We didn't see this in the household, because the way we asked the household is, did your household experience theft? And probably they didn't, but in qualitative data showed widespread reports of theft being attributed to youth, and youth are out of school because either people can't pay school fees, or if they finish school, there's no job opportunities. And the demographics are a little frightening in this area. It's going to be there for a long time. So we saw a variation even in the sample that we had both across and within counties. We are not powered for county level findings, which I mentioned earlier is what people in Kenya want. We saw, like, during the drought, there's flooding in Lake Turkana. Apparently there's flooding in all of the lakes in the Rift Valley. That's either from sedimentation and land washing into the lakes and making them shallower, or there's something happening along the tectonic plate. But there was, in the midst of all this drought, there's been flooding. You see in the earlier flooding data in 2018 that floods followed that drought, and communities lost their water supply. All the pumps washed away, the remaining livestock washed away. We see within some counties where there's a lot of livestock migration, the livestock diseases are increasing because the herds are crossing along the migration camps, along the migration routes. We have data in this survey from both Dadaab and Kakuma refugee camps. Interestingly, the indicators are better in the refugee camps than they are in the rest of the communities. So the array of shocks and duration are beyond what PREG was ever designed to mitigate. And we saw massive variation across the 6 counties. And we're seeing now that after the drought, the rains are here, and the rains are going to come with their own secondary shocks. We don't know, and it's probably somewhere in the notes from Kenya, whether crop inputs were still being provided in advance of this rain. If so, then even if the crops are successful, then we're still a season out from harvest, from people getting any food from harvest. And the price shocks they're not going to ease until something changes globally. The price shocks, the inflation shocks are both hitting households, and the IP said it's incredibly hard for them to do their programming. Prices are up so high.
Sorry, if I could just jump in here. I think one of the issues that we are, based on these, sort of this current reality, and the fact that there has been this pile up really of all of these really severe shocks over the time of the implementation of PREG, combined with, as Stephanie mentioned earlier, a relatively limited humanitarian assistance response, at least up until now. One of our concerns is that when we do the final impact evaluation with the end line data, our concern is that the level of these shocks, combined with sort of the limited humanitarian response, is likely going to sort of have a really essentially wipe out the investments, at least at the household level, resilience capacity. So that's a concern that we have, and we're thinking about ways to tease out as much as we can, how we can address that in the analysis. One of the things is that we in the last couple of rounds of this RMS, that the level of households that reported humanitarian assistance has gone up. It's still low in our sample, but I think that there may be, we can sort of, hopefully we'll have information to look at and be able to measure the extent to which receipt of humanitarian assistance has been able to help protect household resilience capacities. But we're a little bit pessimistic at this point. I think it's going to be a big challenge. Over.
If you don't mind me asking a clarifying question, Mark. So when you say like wipe out, do you mean that because in some resilience investments, we would expect them to kind of, even if they were on like a downward trend because of the massiveness of the shocks, that relative to some comparison group, they might be better off due to those investments. But it sounds like you're kind of suggesting also that there's some component of like when the shocks are so far outside of the programming can't address, that there's no,
right.
like they might decrease and not be able to maintain regardless.
Correct.
Like it's only the humanitarian assistance that is going to help them out.
Yeah, I think that's our concern, is that the level of shocks are, I mean, just to take a very specific, like sort of simple example, we know that one of the critical components of both absorptive and adaptive capacity is assets, and livestock assets in particular in this context. But the reality is that in this last year, everyone has lost their livestock. So that's going to be whether the household benefited from sort of investments to improve livestock markets or enhance livestock production, at least in the short run, that the benefits from those investments are not going to show up, right? So that's sort of one of our concerns.
And another example is savings because the programs have been promoting savings through VSLAs for a long time. In high inflation, and savings is not particularly helpful and does not work very well. We see in our analysis, we see no benefits for households that have savings, even if they have anything left. First of all, they've been mostly wiped out, but any that are left with savings is not helping them.
If I may, thanks, Stephanie. That was probably the most explicit reference to what we are trying to do, promote savings. And Mark, I think, hinted a little bit, besides the dire situation and the terrible things that are happening, in terms of learning related to adaptation. I'm thinking of, probably would be a mistake to go back in and restock and pretend we can go back to the way it was before, and we're going to help communities recover to the previous state. So, I think hoping to learn how, communities and households and people are adapting to this by getting out or changing the livestock management system, or whether the markets are stepping up, or how that's going on. Thanks.
Yeah. So John, one of the things we're our preliminary analysis of the RMS2 has kind of pointed in this direction. We're in the process of strengthening it, and it's obviously something we want to focus on in the end line analysis. But it seems that the interventions that seem to have more sort of positive impacts in this extreme context are the systems level, right? Things that are designed to strengthen household level capacities. At the household level, they get wiped out. But things that are enhancing access to information, local governance, market systems, those kinds of things, our preliminary findings suggest that those kinds of interventions do households that benefit from those kinds of interventions do seem to they seem to be relatively better off than those without those kinds of system level services.
We see some benefit from borrowing, even though there were issues around Sharia compliant borrowing. Households that were able to borrow money early on did relatively better than households not able to borrow money. So maybe that's a mechanism within VSLAs that needs to be made more flexible. I'm not sure how that would work, but in times of high inflation, borrowing is a good idea. Maybe the monitoring should move to not only hunger and monitoring, but to more careful price monitoring. If PREG is doing a lot of work in monitoring price data being a key piece of shocks, so maybe some kind of, I think it's obviously getting more complicated. We need a slightly more sophisticated things that we monitor. And having said that, change is slow and change is difficult. I think people know what's happening and have a lot of information, but moving these big programs is a big deal. Just that it took till September to get humanitarian assistance in. That's a slow process. I don't think the information is lacking, but just the ability to switch quickly doesn't seem to be there.
I see your comment in the chat box, John. I think we will definitely, that will be a theme that we want to focus our analysis on in terms of looking at the adaptability of the social protection. Yeah. Hey, Stephanie, maybe in the interest of time, I'm thinking maybe we can skip over the food insecurity and just go right to the section about the programming, because I think that's probably will give us sort of a
This one?
good overview of what we've learned.
Starting with this one or not, or later?
Yeah, start there, yeah.
Okay, so this
But,
is,
just sort of to steal your thunder a bit, but this was something we presented at the conference. That was very preliminary. You know, we just wanted to have some information that would show the relationships across from programming to outcomes, but you know, as we're incorporating the information that we found about the location of different investments, we're sort of refining this, but this was just a, you know, sort of a first pass at some of the analysis that
Yep.
we
based
presented.
on the data that we have, we think this is the way the system works. And we also wanted to understand the role of cash assistance, and because we had that big jump in cash assistance in round 4, we can statistically test how it works, and to understand how all these systems work together, because in the preliminary analysis, it seems cash assistance is a complement, not a substitute for these other practices, that there are other structural things that need to be in place for cash assistance to work. In some of the counties, the cash assistance, even though it's moving, you know, through WFP, there's no increase in the number of households receiving it. There's some sort of institutional features that have to be in place for cash to move. So this slide just shows that the overall mix of systems level programming, and then that the mix, the number of types across counties varies, and that this is counties have their co-creation plans that they do with the IPs, so that's the county choices of how to allocate money and how this mix works. We can test with simulations some of these combinations of programmings when we get our systems level data.
Yeah, by the way, just to make sure it's clear that this information that we're presenting in this chart, this was information reported from the household respondents about their, you know, their participation in
Well, yeah, this one was from the community survey.
or sorry, yeah, the community survey, yeah, that's right, yeah. But it's now we want to complement that with the you know, the information that we collected at the conference.
And yeah.
Sorry, could you go back just for a quick second? So to interpret this, a household, for instance, or 42% of households reported that they, participated in programming to improve financial services.
Well, okay, the title is misleading. What this means is that 42% of households live in communities with financial services.
Okay.
Because it came off the community survey. The title is not good on this, but that's what that means.
Okay.
Okay. So this is what we saw in the humanitarian assistance data that made us incredibly curious. The food, especially looking at the second set of numbers, in which is RMS 2, the food aid, you know, is up. It was way down in September 22. We heard lots of reports of delays in food aid. The cash aid increased steadily, starting in May, up in September, and then up a lot in January. So we wanted to know, first of all, what took so long? Why there was a drought all the way back to 2019? What took so long? Why wasn't cash aid moving? And then did that cash aid matter? As it turns out, it was an incredibly slow international response to the drought, and it's still an incredibly slow international response for all the reasons that everyone knows. Is every country needs help right now, and the Ukraine crisis is front and center in funding. So this is the cash assistance across counties, and in the right hand side, the first is RMS 1, where it's fairly consistent. The right hand side shows that in sorry, I keep trying to click something off. In some counties it didn't change, and in some counties it started going up in May of 2022. John, did you have a question?
That was an old hand. I'm sorry.
Oh, old cow hand. The other issue with cash assistance is that inflation lowers the value of cash assistance, and the delays exacerbate this. And the amount is fixed at the time the funding is decided. So it doesn't inflation adjust every month or every week. So it loses value as it moves through the system. For some households, food aid works better than cash in households where women have little decision making. If in those households, cash does not always go to provide food for children. And in other households, they're getting enough cash so that women are starting small businesses. We learned from the IPs that one of the problems is that the cash, depending on the donor, the cash aid varies. And a household, once it receives any cash, it's flagged as having received cash. So if a bigger allocation comes through, that a household will get less than its next door neighbor. So the IPs flag that as an issue. As well, the frequency of transfers varies by donor, and we had a lot of reports of transfers happening every couple of months, or happening on a more shorter, more regular basis. One of the reasons for this appears to be it's a donor driven distribution schedule. We heard from Turkana that their cash relative to other counties, their share of the 360 million was very, very small. It was $2 million or something like that. It seems our assumption, which may or may not be correct, is that it's a population-based distribution. But for big counties with dispersed populations, that makes it incredibly problematic. So this is from the household data, the household reported participation in programming. And livestock markets at the top of the list, then clean water, and down the list. It seems like we have that the questions and the way we've put the survey together give an accurate measure of household programming. These two charts are only to show that it varies across counties, just like systems level. And part of this is part of the emphasis in the co-creation plans. Part of it is whether the sample is on the road system.
Yeah, I was just going to say this really, those charts kind of reflect, well, they show that there's a real difference across the counties in terms of how the allocation to the different activities, but that reflects the co-creation plans of the counties, right? Right, Stephanie?
Yes.
Yeah.
We, again, like the shocks, we picked up a lot of program participation information in the qualitative that didn't show up in the household surveys, either because the sample wasn't big enough or the specific questions weren't there. We learned that there are smaller, like sub-programs, like the RMS distributed feed and livestock feed in August, that there are tick control and vaccination programs along livestock migration routes. The kitchen gardens were, there was an IP who wanted to know all about the kitchen gardens that he'd been working on, but we have 2 households in our survey that said that they use kitchen gardens. Information on insurance programs was mixed. In some qualitative interviews, people were saying that, the insurance companies were paying claims and it was sort of changing how they thought about insurance. In another area, that insurance companies did not pay the claims and then went out of business. So it was a mixed. There was some livestock offtake in November of 2022. There's funding in the co-creation plans for livestock. It also appears that there's funding in the co-creation plans for restocking. To your point of, what does the future look like? I think there's a lot of pressure to restock livestock. These are the results from the equations estimating the relationships between systems level programming, cash aid, and household resilience capacities on moderate to severe hunger. We had to use the hunger variable because the food insecurity is topped out. Nearly 100% of households are moderately to severely food insecure. We don't have enough variation in that variable to use it in an equation. This is part of the larger model, the household capacities. There's conceptually a box to the left of this, which is household participation in PREG activities influences these resilience capacities. These are the pieces of the household resilience capacity indices, absorptive and adaptive, that are related to lower hunger. We think that when we use the data that we were receiving from Kenya, we can clean up the systems level investments and have a clearer picture of how this works. What we did is we disassembled the resilience capacity indices because we wanted to see a much more mechanistic, tell a much more mechanistic story of how, what switches are turning and moving as we see changes in hunger. So we use the co-creation plans to understand that.
Sorry, Stephanie, can you just go back quickly to that previous slide?
Yeah.
To me, one of the things that really jumps out from that is that, and I guess it's not at all surprising, but the relatively big importance of improved water and access to health services, that those are things that show, in this context, those are the things that have a big impact.
And we had in these equations all the controls we could possibly think of. We have a refugee camp, we have rural urban, we have county level geography, we have household characteristics and assets. So they're pretty well controls for other variables. There's possibly these house systems level are picking up other information, but improved water and households, and it includes households that reported that during the PREG program they received improved drinking water, was incredibly important for food security. And interestingly, I think
John, you have your hand up again.
Yeah.
Sorry. So you might have said this. These were perception things like responsive government, where people asked, was your government responsive?
That's from a household questionnaire that says, how responsive was your government to local government to certain kinds of.
Yeah, so that one's perception.
That's a household level, but several of the PREG programs are about having these ward level management groups that are made up of community members. The rest of them are all came from the community survey.
Maybe I can follow up on that. Tim, actually this was more for RISE, but I think it applies here. Kind of the assessing the effectiveness of the programming kind of depends on the quality of the program. So, it's one thing,
Right.
One thing to say, ag extension or whatever, And so it was done, but was it done well and properly? And I guess that's probably well beyond the scope of this study, but still raises a question.
Right, that's a good point, and we can think about that, with the data that we have. We ask people about their participation in different kinds of programming and correlations with other variables, and maybe if they have livestock disease or something. We don't, I mean, my assumption is that if the programming, if it's not working well, it's not going to have an effect. To look at it, to go up a level rather than down into more detail.
Yeah, John, I think that, I guess what I would say is that some of these obviously the information we're collecting, will obviously be affected by the quality of, like ag, you asked, did you have access to ag extension services? And we probably cannot really get a very good assessment of the quality of that service. But some of these things are actually what do you want to say? They're sort of the household received the deliverable, right? Like they have access to improved water. So
yeah,
I think your point's well taken, and we'll have to look at these the individual kinds of responses that we have, and determine to what extent are we measuring or are able to measure or not able to measure the quality of those services being delivered. And obviously it's a critical question that we need to, and we have, had questions to address those.
Yeah. Now that I think of it, we do have some of those questions, and we have about livestock services, whether it was, whether they had enough medication and vaccinations, and
just to chime in or pile on maybe on this topic, I think it's also really interesting, in terms of, it's a good point in terms of the quality of implementation. Hopefully in an ideal situation, we would have access to monitoring data that, shed some light on that too, because it's really difficult, I think, even in an impact evaluation, to really go into super detail on all those performance aspects. But I'm mindful of, if we do it right, how exercises like this can complement monitoring data, like I think what Tango's trying to do in Nigeria. So there we have the RRA that has their own internal monitoring, right? And hopefully what Tango's doing there is not duplicating that. I don't think it is. It'd be much more difficult than PREG, with 35 different implementers or whatever, but hopefully there is at some place some kind of coherent monitoring of program quality that could shed some light on John's question too. Over.
Okay.
Carol, I see your hand is up.
Yes, this is also related to the question and the discussion that you're currently having. I think my greatest concern is the improved water, and just recognizing how difficult it is to do water systems and improved water access. I mean, how many times have we gone out and looked at a failed water program 2 years after the project has ended? So I think that interest in long-term sustainability, and I know that the Center for Water, as well as the Water for the World activities, are really trying to take more of a systems approach. So I guess the question is how, how are we either monitoring, ensuring, or that the interventions are really looking at that longer term impact, and having that longer term time horizon rather than just project oriented.
Yeah, I would say that, that is certainly a really important question, not only for water, but all kinds of systems. What our analysis is showing, at least for now, is sort of only the current benefits that are accruing from the household's access to these systems. So I think that we're in this analysis, we're only looking at sort of the current benefit of the existing systems. How, what's being done to strengthen and make those systems resilient is certainly an important question. I think we could, that's a question that we could address in the qualitative component. But I think that since we're getting information from households about sort of their current situation. I don't know how much certainly with a quantitative analysis, we'd be able to look at address this or even understand the sustainability of the systems, but certainly important questions.
Yeah, we hear from the qualitative about salinization. We also hear stories of people seeing the colored wire on the solar pumps and taking off the colored wire and making a bracelet out of it. So things like that, but we're not. But the point is really important. Why put these things in and then have them deteriorate to zero?
I think what this does tell us, and please let me know if I'm misunderstanding this, I did miss the first part of the session, but to me, what this identifies is those things that can be, those programmatic approaches that can be most impactful for improving food security. So then maybe it means engaging our Center for Water and Water for the World activities to try to create these greater discussions of partnership or engagements on how to make these things more sustainable. The same thing with our access to health clinics. How do we ensure that has that long-term vision and approach? Access to markets again. I'm an agriculture development officer, and I'm a little concerned about the ag extension services and having see that to be so low. And I think that could, to me, what this does is this identifies those points of where perhaps we can have a deeper dive and where we're most effective and where perhaps we need to take a second look.
Yes, and the other piece of this is that this is only household hunger. We don't usually see a big relationship between ag extension and household hunger. We also, one of the things we look at is self-reported recovery from drought. In that variable, we see things like ag extension being incredibly helpful. So the importance of these variables changes depending on the outcome.
Yeah.
It's a
I think,
dynamic.
I think the other thing that we need to keep in mind is the context in which, so this is results from the second RMS, which was, during the time when all of those shocks were hitting northern Kenya very hard. And, so what we're saying is in that context where people don't have any livestock and there's, a really bad drought, extension services don't have such an important role, and access to water and obviously has a really critical role. What we've seen in earlier studies that we've done in sort of what you might say less severe situations, we see the relative importance of ag and livestock extension services, relatively more important. And not so much of water. But again, as Stephanie said, the relationship on extension services to food security or food household hunger is not so large or direct. It's more on sort of household livelihood characteristics.
And because no households have recovered, we can't estimate that equation because it doesn't vary.
Yeah. So am I right? We only have about 5 minutes left.
Yeah. So I think
I'm wondering if
we can wrap it up. I think. I mean, you say what you need to because
I'm just.
That's all.
I think we've kind of talked about a lot of the stuff. Do we want to just sort of review maybe for what our next steps are?
Yes, I can do that. Our next steps are for the RMS 2 to incorporate the systems level data that we're receiving and the participation data and the community data to get a better measure of the systems level variables to use in our equations. We didn't mention, but some of the systems level data are coming in the GIS database. This meeting, besides helping us, helped spur that, incentivize IPs to provide data to the GIS system, which some of them had not been doing. There was some pushback to us about how we chose our sample, and we used their database to draw the sample. So there was some egg on some people's faces about, it did motivate everyone to get the GIS database updated, and we'll use that in our analysis. The bigger picture is to prepare for the PREG end line. We are thinking about and considering expanding the sample to have a better county level representation. Of course, there are issues with, a panel for some and not a panel for some of the data, and modifying the research questions if we need to. So we at Tango found this meeting incredibly helpful, and the participants too said, oh, we should have done this in the beginning. We should be doing this all the time. The piece that has to happen is, like SAVE and RLA and Center for Resilience, it takes money, it takes per diem to get people in the room is the fact of the matter. Like me sending an email around didn't work. It's not gonna get anyone to participate. It's a big effort. But
Yeah.
people did come, they were really engaged.
Yeah, I think that's an important point. Yeah, it's this information is really, really helpful and useful, but it requires organizing meetings, having this, in person in Kenya was really helpful. So it requires resources and planning to do that effectively. And I guess we're in the process now of updating the protocol for the end line. And, as Stephanie mentioned, we've got a really sort of strong request that we think about increase the sample so that we can power the results at the level of the county. I don't think it's going to, at sort of the back of the envelope calculations that we've done so far, but it's not going to be a huge increase in the sample size. There's several counties are already sort of the sample size is large enough. We need to be very clear that increasing the sample size will allow us to provide statistically representative data at the county level at the end line, right? The analysis of change from baseline to end line will still essentially have to work with our original sample. But I think there was a very strong interest from the participants, the counties in particular, to have, even if it's just the end line data, that we have results that are representative of that for the end line. Yeah, Nate, your question about the protocol. Our intention was to have that by the end of the month. I think that's what end of next week. It might be the week after that, but in the next 2 weeks. By the way, on the end line, one of the questions that we asked, because we had a feeling that there was probably going to be some delay in the timing of the field work for the end line, and we were told that if the field work was done by November, the data would be comparable to the baseline, would be in the same, within the same, would be within the hungry season. So, that's we're trying to keep on the same schedule, but we have, we are in the possibility we do have the possibility of postponing a little bit the.
I'm just curious, Mark, what was the driver of that delay?
Just finalizing all of these, you know, the protocol, getting approval of the protocol and that.
Okay. And another like related question I had is, you know, certainly in the protocol, we'll want to make sure everyone is on the same page with regard to sampling strategy,
Yeah.
including any kind of changes that you're
Yes.
talking about. I was wondering, do you expect any significant changes to the instruments themselves? I imagine probably not big changes, but to the questionnaires.
Well, certainly there'll be changes to the qualitative tools, particularly around some of these things we've talked about even today, about you know, perceptions of the impacts of different programming in the context of, you know, the severe shocks that communities are experiencing now. So I think the qualitative tools, there'll be some changes. Obviously, the quantitative tools, you know, we have to ensure that the information that we get in the end line is comparable to the baseline. We may, you know, there may be some additional, well, there will be some additional follow-up questions that we will have. I guess then the big, you know, the one area where we know there'll be changes will be the questions around project participation, right? So that will be informed by the information that we got from the workshop.
Okay, thanks. I want to like let John, Nate, Carol, if you have any questions, Laura, weigh in with them. I think, John, maybe in subsequent real kind of managers meetings, we can revisit the specific timeline for this and the process that works best for submitting kind of draft protocols and draft inline instruments for review so that we can be as efficient as possible.
Okay, sounds good. Was I next? I have a hand raised. Anyway, I'll just go ahead. So we, in the course of trying to collect some case stories, not case studies, we got this one from CUSA, which I think is an important element of PREG. And it spoke of a particular woman who had been supported by the program, experienced certain shocks and got through the shocks in good shape, et cetera, et cetera. And, you know, it also spoke of her as being part of a economic transformation that's going on in the ASOLs and the so I'm just thinking that you know, part of our challenge for making a case for resilience or you know, telling the resilience story is linking a case like that to the larger quantitative survey. And we you know, that particular case, it has no value if it's a total outlier. It's amidst all the misery, there was one person who succeeded. That it should be, you know, part of a much larger group. And so I don't know where I'm going with this, but just maybe that's part of the tying the qualitative to the quantitative. Is trying to find successes and then showing how general those successes might have been.
So yeah, John, I know we had talked with you earlier about the possibility of thinking of a you know, within the context of our study, it's a case study. And what we were thinking particularly was, you know, again, now that we have this information about our the different mix of activities in our sample and the clusters in our sample, you know, we were thinking about trying to set up a case study, which would be either maybe only qualitative or perhaps have a quantitative component as well, but where we would focus on an area or maybe a few areas where the level of complementary activities is high, right? And really have stories from those places where we really see sort of the or where we have the capacity to see sort of the complementarities of the layering of all the activities. So I think that's certainly something that we would, we've been thinking about, would like to pursue as well.
It's good. And I guess even a story of someone who participated fully in the program, experienced the shocks and failed. You know, that happens too.
Yeah. I mean, I think that we would, yes, well, what we would like to do would be not to just have sort of single stories, but sort of, even if it's qualitative, but more, patterns that we see in particular areas.
Yeah.
Okay, well, appreciate Stephanie, you and Mark adapting on the fly. Thanks for everyone who's shown up. I don't want to cut this off, but I'm mindful of time. So kind of want to open it up for any last burning questions, but also just kind of a recap of next steps. So are there any kind of final questions from anyone here for any side?
No final questions, but I am really interested in seeing as you start to pull all that data together for the treatments. I'm really interested to see how that starts to break down.
Okay.
We'll keep you posted.
Okay.
Same here. Same.
Great.
Yeah.
Okay, super. Well, we had touched base just internally because we've got these the longer version of notes. I think we've got an abbreviated version of the notes that came from the actual consultation. So we're happy to send those. You've got this presentation for sharing with anyone who's interested and couldn't make it today. Mark, if you could discuss internally kind of timelines for the protocol, and then when you get a chance, just update it on that work plan tracker we have for real. And then we'll discuss that with John and Nate going forward. So it sounds like data collection is likely to be after September now sometime.
Well, yes. We'll discuss and get back to you.
So just keep us updated on that. And then Stephanie, you were reminding me as well, the RMS2 report will be in fact a kind of overview synthesis of all 4 rounds of RMS2. And I think you're planning to have a draft of that later in the summer, correct?
Correct. And that's different from what we're presented today. We created, a comparison group and a treatment and control group. It's much more rigorous methods. And I can start on that. I can do that piece while Tom Bauer is cleaning up the systems level data. So we're moving forward. We've done it before, so it shouldn't have any giant, potholes or whatever.
And as a clarification on this slide, it says due in July.
Yes.
Okay.
Yeah, just so that understand this little piece of traveling. I mean, I feel like we changed gears midway through these RMSs to try and get some timely results out. So this is not the round 1 through 4 analysis. It's just sort of it's a continuation of the reports of to date where we are. And now we go back to
like a summary
protocol.
3-page summary.
It's a progress report. Now we go back to the original protocol and do the analysis.
And that will be later.
Be in the summer.
Be in the summer. Okay.
And as quickly as possible. And we learned too that in these situations that where the shocks aren't changing, this RMS system needs to be a lot more responsive. Because in the past, you could see in the RMS1, well, the drought came, the drought went, the flood came, the flood went. So it wasn't just wasn't ongoing agony that we needed to. We need to tweak this process so we have something actionable throughout.
Yeah, and I would expect that, that'll have implications, maybe minor at that point, but that analysis may have implications for design of the inline too. So
Yes.
Nate, John, I don't know what you prefer. It's early for that now, but I assume that Tango's going to want to have some kind of working calls with you to make sure, if there are any outstanding questions about the sample design or the instruments themselves, we'll do that in time as well over this, or they're proceeding on multiple fronts.
That would be great. Yes.
Yeah, and if we could shoot you a note on the RMS analysis too, if there's a place where we want to have a, discuss, which way to go, and that we'll get in touch with you and try to set that up.
Sounds good.
Okay.
Hey,
Okay.
thank you very, very much. Really interesting, useful, and we appreciate the kind of double duty. And we'll look for the emails and see you again soon.
Okay, great.
Okay.
Have a
Yes,
great day.
thank you all.
Thanks, everyone. Yeah,
Thanks.
Thank you.
thanks. Yeah, bye.